Are you ready to find out why lowering your triglycerides may do more for your heart than chasing a lower cholesterol number? Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're breaking down how you can support healthy cholesterol levels naturally without defaulting to statin drugs.
I'm Alara Sky. Together, we'll clarify what cholesterol really does for you, why high triglycerides and chronic inflammation deserve more of your attention, and which diet, lifestyle, and plant-based strategies have solid science behind them.
Let's start with the basics. About 80% of your cholesterol is made inside your body, mainly in the liver, while only 20% comes from what you eat. That internal supply is crucial for hormone production, cell membranes, vitamin D synthesis, and bile acids that digest fat.
Exactly. Cholesterol also protects your nerves by building the myelin sheath and supports brain signaling, learning, and memory. So instead of labeling cholesterol good or bad, focus on balance, especially the ratio of total cholesterol to HDL and the interaction between cholesterol and triglycerides.
Triglycerides matter because high levels raise heart attack risk by roughly 80%. A simple way to gauge that risk is the triglyceride to HDL ratio. The lower the ratio, the better your outlook. High triglycerides often point to excess sugar and refined carbs, not dietary fat.
That shifts the conversation from total cholesterol to metabolic health. Research now links plaque buildup more to chronic inflammation than to LDL alone. Two lab markers tell the story. ApoB counts the number of artery-injuring particles, and CRP tracks systemic inflammation. Ask for them with your next lipid panel.
If your ApoB or CRP is elevated, lifestyle beats medication for first-line care. Here's where the Pareto principle comes in. A focused 20% effort, cutting added sugars, walking 30 minutes daily, and prioritizing quality sleep often drives 80% of your improvement.
Let's talk nutrients that move those numbers. Oats supply beta-glucans that trap cholesterol in the gut. Plant sterols and stanols in nuts and seeds block absorption of dietary cholesterol. Green tea polyphenols nudge LDL downward by a few points and provide antioxidant backup.
Garlic stands out with thousands of studies showing drops in total and LDL cholesterol, along with less platelet stickiness. Artichoke leaf extract can trim total cholesterol by up to 18%. Bergamot, the citrus behind Earl Grey tea, lowers LDL and triglycerides while nudging HDL higher in several small trials.
You'll also hear about red yeast rice. Yes, it can cut LDL by a third, but it contains monocolin K, the same active molecule as lovastatin, along with possible kidney-damaging citrinin. If you want to avoid statin-like side effects, look elsewhere first, and monitor quality closely if you do choose it.
Beyond supplements, exercise improves 5 key biomarkers Casey means, MD highlights: fasting glucose, HDL, triglycerides, blood pressure, and waist size. Whether it's 40 minutes of high-intensity intervals or 150 minutes of brisk walking each week, movement reliably shifts every one of those markers in the right direction.
And remember, dietary tweaks take time, often 3 to 6 months, while statins act in 4 to 6 weeks. Stay consistent. Replace sweetened drinks with water or unsweetened tea, load up on vegetables, legumes, and whole grains, and include oily fish for omega-3 support.
Choosing foods that stabilize blood sugar also tames inflammation. When you cut high fructose corn syrup and white flour, the liver stops overproducing triglycerides, and your ApoB count can fall without medication. Small actions, like cooking with turmeric and ginger, layer extra anti-inflammatory protection.
To keep progress measurable, track waist circumference. A tape measure is cheap, and research shows fewer than 5,100 steps per day predicts central obesity, while closer to 9,000 steps slashes that risk. Pair movement with at least 7 hours of sleep to maintain insulin sensitivity.
It's also worth dividing total cholesterol by HDL. If you land at 4 or below, your risk stays low, even if total cholesterol looks high on paper. Numbers tell a clearer story when you consider ratios, triglycerides, and inflammation together, rather than chasing a single LDL target.
When you discuss results with your clinician, ask how your individual genetics, stress levels, and hormonal status may influence cholesterol production. Identifying the triggers helps you tackle root causes instead of masking symptoms with a lifelong prescription.
Let's pull the main points together. Your body manufactures most of its cholesterol for essential tasks. High triglycerides and inflammation, not dietary cholesterol, drive heart risk. Natural fibers, plant sterols, garlic, artichoke, bergamot, and green tea can all help, while red yeast rice needs careful oversight.
Lifestyle works because it hits multiple targets: glucose control, lower triglycerides, a healthier waistline, and calmer inflammation. Consistent movement, nutrient-dense foods, and quality sleep activate the same internal healing pathways your body relies on to repair daily wear.
Ready to translate this into action? Your challenge. Today, remove one processed snack that lists added sugar as a top ingredient and replace it with a handful of raw nuts or a serving of fresh vegetables. Track how you feel over the next week and let that data guide your next step.
Thank you for joining us. We'll see you next time on Dr. Mercola's Cellular Wisdom.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.